Mindfulness-Based Supportive Therapy, or MBST. Mindfulness-Based Supportive Therapy is a psychotherapy designed to address the suffering of individuals in palliative care. It involves cultivating mindfulness during interactions with patients, their family caregivers, and even healthcare colleagues. Below are the key components of MBST to internalize and practice effectively. Before engaging in a session, bring to mind a specific person you wish to interact with. This could be a patient, a family caregiver, or a colleague. Someone who may be challenging to engage with, or simply someone you wish to support. Visualize the interaction vividly, imagining the environment, the person's demeanor, and your role in the scene. Once you feel ready, begin with the first component of MBST, mindful presence. Begin by focusing on your breath. Inhale slowly, feeling the air move through your nose, down to your chest and abdomen. Exhale gently, noticing the air leaving your body through your nostrils. Gradually expand your awareness from your breath to your entire body. Then, shift your focus to your surroundings and the imagined person in front of you. Be fully present for the person, as though they are the only person in the world. Maintain your eye contact as much as possible. Observe their facial expressions and body language attentively. Should you feel judgmental, rushed, or anxious, gently return your attention to your breath and the body before refocusing on the person. The second component of MBST, mindful listening. While maintaining awareness of your breath, begin to listen deeply. Expand your focus to include not only what you see, but also what you hear. Pay close attention to the person's speech, his pace, rhythm, pitch, volume, and the silences between words. Listen with an open and curious heart, creating a safe space for the person to share. Seek to understand their experiences, feelings, thoughts, hopes, and expectations. If you notice yourself judging, feeling the urge to interrupt, or offering premature advice, gently return to your breath and focus on being fully present. The third component of MBST, mindful empathy. As you breathe and listen, imagine stepping into the person's world. Strive to understand their feelings, thoughts, desires, and emotions. The most important element of empathy is to understand what they truly want from you, and allow the person to be exactly as they are without judgment. Acknowledge, validate, and normalize their experiences to convey empathy when appropriate. If you sense any vicarious emotion or resistance within yourself, gently return to your breath and focus on empathizing non-judgmentally. The fourth component of MBST is mindful compassion. After understanding the person's experiences and hopes, nurture compassion in your heart. Open yourself to their suffering, feeling their pain without becoming overwhelmed. Rest in a shared sense of suffering, and silently wish for their freedom from pain. Express compassion through thoughtful words and actions aimed at alleviating their suffering. If you feel judgmental, overly attached to outcomes, or emotionally overwhelmed, return to your breath and compassionately refocus. The fifth component of MBST is mindfulness of boundaries. Throughout the session, maintain awareness of both personal and professional boundaries. For personal boundaries, distinguish your feelings and thoughts from those of the person you are supporting. Balance self-care with patient care by being fully present, yet mindful of time constraints. By avoiding countertransference or vicarious trauma, and monitoring for compassion fatigue or burnout. After the session, reflect on whether you feel emotionally drained and take appropriate steps for self-care. As for professional boundaries, contemplate crossing a boundary only if it aligns with the patient's best interests and professional ethics, ensuring equitable care. Avoid judging the patient for behaviors such as asking many questions or making requests that seem unreasonable. If you feel the urge to act in ways that might harm the patient or yourself, gently return to your breath and realign your focus on maintaining appropriate boundaries. Mindfulness-based supportive therapy encourages full presence, deep listening, genuine empathy, compassionate speech and action, and full awareness of boundaries. By practicing these components consistently, you can create a supportive and healing environment for patients, caregivers, and colleagues alike. If challenges arise, always return to your breath and body, grounding yourself in the principles of mindfulness.